are millions of people living in pain, right? If you're one of them, you may have tried everything. I'm talking injections, creams, maybe even medication. Well, if you are looking to find the root cause of the problem so you don't have to live in pain anymore, then you need to come see this man right here. Visit his clinic. I'm an integrated spine, pain, and wellness with Dr. Ashu Goyal. I have learned so much talking to you already. Thank you for inviting us over.
Oh, thanks for having me.
Absolutely. First of all, let's talk about your approach. The root cause. How do you get to the root cause? Because I'm guessing by the time people get to you, they've been in pain for a while, right?
For sure. Yeah, sometimes years.
Right.
Right. So how we get to the root cause is by actually spending time with the patient, taking their history, learning what they're about, like what things motivate them to be who they are, right?
Right.
So by asking these questions and listening to them, we can find out where their pain could be stemming from. Sometimes it's dietary, sometimes it's lifestyle, sometimes it's stress, sometimes it's emotional. So it's a matter of taking all these factors into consideration, because sometimes it's not as simple as a herniated disc, a slipped disc hitting your nerve causing sciatic pain.
Right.
Other times with chronic pain, it's way more complicated than that.
Yeah.
And there are multitude of factors that can contribute. So it's a matter of really spending time with people and deciphering what it is that's contributing to their current pain symptom.
I've been living with chronic pain for years, and you and I have been having this great conversation about that. So I'm excited to let everybody know about your approach. So well, you have a lot of approaches here. You do the IV therapies and you do nutrition and all kinds of things here. But regenerative medicine is a hot topic. It's a button that a lot of people are pushing these days because we're hearing good things about it. So give us your take on regenerative medicine and your approach.
Sure. So regenerative medicine is a field of medicine where we're using the body's own healing ability to treat injuries and chronic conditions. So I think it's the future of medicine. So I think in 10 years, it's going to become the standard of care, especially for joint injuries,
yes,
for arthritic changes, things like that. So what we do is we harness the body's healing ability either by concentrating bone marrow, which is where your stem cells are, fat tissue, which was where you also have stem cells, or your blood.
Okay.
So we can harness your platelets and plasma, concentrate those growth factors and proteins that float around in our body naturally, and deliver those to different parts of the body to help them heal.
Where can you do, these are injections, right?
They are.
That you do of our own properties.
Correct.
Where in the body can you help?
Everywhere.
Really?
Pretty much from the cervical spine, the neck, the mid-back, low back, every single joint, every tendon, every ligament.
Because it's not always the joint that hurts, it's everything around it, right?
That's the thing, exactly. So one of my approaches is to treat the whole functional unit, is what I like to call it. And that's kind of the approach in regenerative medicine or orthobiologics. If we're treating back pain, we're not treating just one segment. We're treating all the segments that may be involved, the ligaments, the muscles, and all the joints.
And that's how you get to the root cause.
Exactly.
Right? It might be all over the place,
For
right?
sure.
Okay, and we're in a procedure room because you do it right here in office. So this is where the magic happens, so to speak, right? And it's guided. We're looking at the imagery here that you use to guide the needle to get it to the right place.
Exactly. Every procedure I do is image guided because we want accuracy. When we deliver these biologic therapies to an injured area, we want to make sure we're at the injured area, not in the general vicinity. So we use a combination of ultrasound or fluoroscopy, which is an X-ray machine.
Okay, this is a big question, but answer it for me quickly if you can. Once you have regenerative medicine, does it last?
So all the studies are showing 12 to 18 months is typical for a regenerative medicine procedure. We're seeing that bone marrow can last longer, up to 2 years, sometimes even longer. And it really just depends on the condition we're treating.
Right.
I'll give you an example. People come in a lot of times with tennis elbow. So I'll examine the patient. If they've done physical therapy and failed more conservative treatment, we may get an MRI, look for the degree of the tear. If it's a partial thickness tear, those can actually heal with PRP.
Oh, okay.
So it's amazing. So it's one and done.
So it's healing. Well, that's the whole point. It's healing. So that's going to last forever.
Potentially, until it's re-injured.
Oh, well, okay. That's a whole nother story.
Exactly, yeah,
All right,
for
Dr.
sure.
Goyal, thank you so much.